over to my colleague. I'm going to turn it over to my colleague who will run through our presentation, and it's built in with the point-click care demonstration by Cheryl. So whenever you're ready to start, we can do some quick intros and background, and then we jump right into the content.
Well, I think let's go ahead. It's 4 minutes after, and I don't want to keep people later in the evening than necessary.
Perfect. So thank you everyone for joining us on Thursday evening. You're joined by members of the Project AMPLIFI team. We work out of St. Joseph's Healthcare in Hamilton and are leading the provincial data integration work across the province. With me are members of the project management team and our training and change management team to help support the delivery of this presentation. My name is Tyler Aird. I'm the senior project manager from St. Joe's. Rob, do you want to start and introduce yourself?
Thanks, Tyler. Hi, everyone. My name is Robert Steele. I'm project manager at St. Joe's and also on Project AMPLIFI.
And Reneel, do you want to go next?
For sure. Nice to meet everyone. I'm a project analyst with Project AMPLIFI. Sherry?
Hi, everyone. My name is Sherry Palkley, and I'm the change management and training lead for Project AMPLIFI.
Thanks, all. Sorry, Sherry, I thought based upon you driving the presentation, you could go last, but I did not want to forget Cheryl before we started the presentation.
Thanks, Tyler. I'm Cheryl Dieterle. I'm the Director of Advisory Services for Care Coordination at Point Click Care. So nice to meet everyone.
Sure. Sorry, give me just one moment here. Okay, my apologies for that. Okay, so thank you so much for being here with us this evening to talk about Project AMPLIFI and how kind of this impacts your day-to-day and your workflows, and how kind of we are here to support you to use this new functionality and resource to you as clinicians. So I've prepared some content just to kind of inform our conversation today, but please don't hesitate if any questions arise to use the raise hand function. There's time allotted at the end for questions, but again, we can be pretty informal this evening. Again, this content is more kind of just to guide the conversation. So just a quick overview of our plan for this evening. So my colleague Reneel is going to provide us with some background and overview to the project, and then Cheryl will provide us a demonstration of what this looks like within the point-click care test environment, and then I'll kind of shift and talk about kind of what the impact is to your day-to-day workflows as physicians and NPs working in long-term care homes, and as well as some other impacted users within the setting. And then just will highlight some of the change management and training resources that are available to you and your teams to leverage to kind of learn more and kind of further your knowledge of the workflows and of the functionality. And then we'll just finish off. I just have a few slides from our research coordinator, just highlighting the benefits realization work that we are doing and ways for you to get involved and as clinicians in that work. So with all of our meetings, we like to start with our project vision, just to ground ourselves in kind of why we are here and what we are hoping to achieve through this work. So the vision for Project AMPLIFI is to improve the continuity of care for long-term care residents by streamlining transitions between care institutions, leading to safer care for Ontarians and more efficient workflows for providers. And I have a brief video, just it captures effectively what our project background is.
Ontario's long-term care homes provide care and support to over 100,000 people and their families every year. Supporting individuals across the care continuum improves health outcomes. So how do we ensure these Ontarians receive the quality care they deserve? Introducing Project AMPLIFI, a clinical data exchange project funded by the Government of Ontario to digitally connect hospitals with long-term care homes province-wide. Each year, there are more than 37,000 transfers from hospital to long-term care. Project AMPLIFI focuses on data exchange at these critical transition points, creating seamless communication between physicians, nurses, pharmacists, and caregivers on both ends of the care continuum. This instantaneous, secure transfer of health data helps Ontarians receive streamlined and timely care by reducing delays, unnecessary diagnostic tests, hospital readmissions, and the need to reshare one's clinical history. This allows providers to spend less time gathering health information and more time providing quality care. Project AMPLIFI, enabling the bidirectional exchange of digital health information to support the wellness of Ontarians in long-term care. For more information,
So before we delve further into our kind of project background and overview content, we just like to provide some context as to the project name and the branding. So to amplify means to enhance or add detail to. The amplification really encompasses our project vision of being able to kind of enhance the way that clinical data is shared between these critical points in the patient's journey, their transfer from between hospital and long-term care, and also add an additional level of detail to the health data that is exchanged. Our logo is reminiscent of a Wi-Fi icon, symbolizing connectivity. Amplify is also a mnemonic. The A is for allergies, M for medications, your PL for problemless, and lastly, I for immunizations. The AMPLI data, or more commonly referred to as the PAMI data, is the clinical data that is exchanged between these, again, two care settings that can then be reconciled or easily added to the local patient's chart. Lastly, we changed the Y in AMPLIFI to an I to highlight the integration between hospitals and long-term care homes. Okay, and I will turn over to my colleague Renil to take us through this next section of content.
Thanks so much, Sherry. So really a bit of an overview of the project. The St. Joseph's Healthcare Hamilton team was tasked to lead the implementation of the clinical exchange between hospitals and their network of long-term care homes across Ontario. And the Ministry of Health and Long-Term Care funded the project, and it is expected to be completed over a 3-year period. So it began really in April 1st, 2021, and is concluding March 31st, 2024. And Team AMPLIFI has confirmed that 73 hospitals and health systems are within scope, along with 477 long-term care homes. And only long-term care homes operating point-click care as their EMR are eligible for the integration at this point. And just for context, point-click care operates in upwards of 90% of market share within the province for long-term care homes. The funding model. So really, the beginning of January of 2022, the Ministry of Health approved funding to support the implementation of the solution, the post-acute care network management solution, to connect hospitals with their network of long-term care homes across the province. And the current in the current cost model, the use of the technology, or the cost of the technology, is borne by the hospitals with zero cost to long-term care homes. And project funding covers the cost of software implementation, as well as ongoing patient transfer license fees until March 31st, 2024. Post-project funding is currently unsecured. However, as part of the project, the St. Joseph's Healthcare Hamilton team is completing an extensive benefits evaluation to determine the usefulness and the value of this integration. And the Ministry of Health will be assessing the usefulness of the technology to determine operational funding continues to hospitals across the province. And so a bit about the integration of the integration solution and its functionality, what it can really do. So First, it can successfully match patient records between software systems. So it facilitates that bidirectional clinical information exchange between the hospital's HIS and the long-term care home's EMR system. It can exchange encounter-level read-only data for viewing in real time during the patient admission and arrival process. And it facilitates a discrete data exchange. So Sherry had mentioned earlier, but it really facilitates that problem list, medication, allergy, and immunization record reconciliation within the patient's local chart. And so this is an overview of the hospitals within scope of the OHT. So Cornwall Community Hospital had its unidirectional go live March 2023, and its bidirectional go live November 2023. Hospital Glengarry Memorial, which is Meditech site, will have its go live February 2024, and it lists as well the CHAMP cluster hospitals within scope, and Winchester District Memorial Hospital, which is an Epic site, has been live since November 2022, along with its associated Atlas Alliance hospitals.
All right, so I just wanted to highlight on this slide that as part of the OHT of Cornwall, Glengarry, and Winchester District Memorial Hospital is part of the OHT, but even beyond the OHT, any of the hospitals that are part of the CHAMP cluster are part of that and part of the Atlas Alliance hospitals, you will also be able to exchange clinical data as part of your like any of the long-term care homes within their networks that are in scope. So I just wanted to highlight that piece. Yes, Marilyn, I see your hand raised.
Yeah. So I'll just jump in and say that then encompasses, as far as I know, every hospital in the former Champlain Lynn. Cornwall is the only Cerner instance across our region, and then the rest of the hospitals are all either one of the CHAMP group or the Atlas Alliance. So we're very fortunate in that respect. Maybe not as fortunate as the Southeast when they complete their Lumio project, but we do have a fairly unique situation where we're not all over the place, at least. So this is helpful. Thanks.
Yeah, you don't have some areas they'll have like pockets, unfortunately, whether the hospital's not in scope, and that creates these pockets in the province. So yes, for your region, you have quite a large number of hospitals that are in scope and going live on the project.
So much, Sherry. So this is a slide just overviewing which long-term care homes are within scope under the hospital system. So for Cornwall, there are 8 long-term care homes in scope. I won't read them all, but it's just providing really an overview. So Atlas Alliance, 51 homes. And these are the homes that are connected within the CHAMP cluster as well, 54.
And also just to highlight, and I know I acknowledge that many of these homes again are outside of your OHT. However, we do capture based on kind of the network of long-term care homes that are part of that hospital integration. You'll notice, I'm sure there's quite a bit of overlap between the slides and between kind of which homes are in scope and are not. But again, there'll be lots of homes that are within the part of the OHT. But this is just a comprehensive list of all homes that are integrated with the 3 hospitals indicated.
Perfect, thank you. And next, Cheryl will take us through a demonstration within the point-click care environment. Thanks so much, Cheryl.
Okay, before I start, I kind of just wanted to get some context from Marilyn and team. I know you have a group of Ontarians that you kind of are managing. And do you visit them in the homes? Like, what's your interaction in the long-term care?
Well, I'm going to say I'm the clinical lead for the OHT, and I retired from full-time family practice about 3 years ago. So I'm going to step back from that answering that question, and I'm going to pass it off to my colleagues who are on the call. If somebody wants to put their hand up or wants to just jump in and answer that. I can say what I used to do, but I don't do it anymore.
I'm a family physician. My name is Shamita Nurani, and I work as a family physician in Osgood Care Center, and we do use point-click care.
Okay. That's what I was just trying to gauge your familiarity with the application before I go into it. So feel free to ask me questions though as I go on, but I think that some of this will look familiar to you then. So let me go ahead and share my screen. What I'm going to share right now is just my demo environment, but it should look exactly like when you log into point-click care. I've got my fictitious patient here. Let me make this bigger. Andre AMPLIFI, and I'm in the clinical section of point-click care here. And you'll see that I've got all these different tabs and I'm in the clinical chart. And I've got this new tab now called the inbound tab. And it's just as what the name represents, right? It's a receptacle for any data coming into point-click care from third parties. So in this case, we're going to be focusing on what comes in from the health systems that you just saw in the previous slide. But it also is the repository for the provincial imports like OLIS. You can see this button here. They click that, then they can pull like lab data and things like that right into the inbound tab. But today, the workflow I'm going to talk about is if a long-term care resident goes out either to the emergency room and back, or then maybe he's admitted and back, or maybe it's the first initial admission from a hospital stay into the home. Either way, there's normally a transfer of data from that hospital encounter to the long-term care home, but occasionally, you know, it's paperwork that goes on a clipboard. It might be fax, it might be email. Sometimes you don't get anything, or maybe you don't get the complete picture. So what we're doing here is electronically pushing it right into the EMR, into point-click care, so those long-term care end users have it easily available. So the first thing I'd like to highlight is that if the resident in the long-term care home has had multiple encounters, you can always go and back to any previous encounter that they've had. You can also sort by different, health systems. If they moved around from hospital to hospital, you can sort and find it that way. So then you could just hit submit and get to the period that you want to look at. The very first thing that I like to highlight when showing this data exchange, the document itself, like I mentioned, it typically should come with the resident, and it can be quite lengthy. If you look at this example here, I've got all of this content that came in from the hospital. So you could see how invaluable that is for that physician, looking at that resident, helping to admit them, that nurse, helping to admit the resident, their RI coordinator, etc. So they can get to any section of the paperwork by clicking on these hyperlinks, or they could scroll through the document. One of the things they really value is the last administered dose given in the hospital. So you can see here, I can click to that and I can see the date and time stamp and the dosage and route for that medication. But again, everything's in here that you saw in that table of contents. What we've done though, is we know that that's very valuable. It can take some time to look through, right? But we've also parsed out some of the key elements so you can quickly say, I just want to see what meds this patient was discharged on from the hospital. And that's exactly what this list is. This is the list of medications that were active when they discharge, what the physician wants them to be on when they leave the four walls of the hospital. So the end users in the long-term care home use this list for their med rec, and then they'll add the appropriate medications to the patient's chart, resident's chart, if appropriate. A lot of times they might have had that. If the resident was in their home, they've already had that on their chart. The diagnoses and are the problems that were active again from the hospital. So typically a lot of these too, they might have had already, but maybe there's a new one, for them. Maybe they're new diagnosis of asthma or diabetes, and they can just come in here and they can activate it and make it part of the chart. Now I'll show you what that looks like when I get to the allergy section. So if I want to add an element to the resident's chart, I simply come over here and click the word add. And this applies to, diagnoses and the allergies here. When I do that, you can see it opens up in a screen, and this is the exact same screen they use whenever they're adding an allergy or diagnoses, medication, etc. So now they can just edit it. Maybe they want to make that allergy a food allergy. They can write any comments and they can hit save. And once they hit save, it would actually say activated here under status and would actually flow right into that allergy tab. Same thing with the medications will eventually be reconcilable like that, so they can go right into the orders. The diagnoses are currently reconcilable, so they can go right into the problem, the med diagnoses tab. And my big news this month is with our next release in Point Click Care. We were just talking about all the new things that happen, is that going forward, the immunizations will be reconcilable, so that with a few clicks, the end user can make that hepatitis A actually go right into the resident's chart. So really what's this doing is it's making the information readily available, but also saving them time so they don't have to retype, you know, what came in that paperwork. It's already here. With a few clicks, they can activate it or they can change it if need be. Any questions so far on what you've seen here?
I have a question, Cheryl. So the medication database is going to be pretty straightforward. The hospital's going to have that. The vaccine database, is that pulling from the DHIR? Where is that pulling from? Or is that just vaccinations given in the hospital?
It's actually usually, it depends on the vendor, but the hospital, but it should be pulling in from the history and anything that was given in the hospital too.
Okay, thanks.
Yeah. And we're sending over that resident's history when we send it back to the hospital.
So I have a question. Is when the patient is going to the hospital can see the point click care and get the data, or we still have to send papers with the resident?
So this is bi-directional. So
Okay.
I'll show you in a few minutes how we send it over, but we do send data bi-directionally. Right now, though, for the project, because we're still rolling it out to all the hospitals and all the long-term care homes, we are advising that the end users still send the paperwork so they don't have to remember, oh, is this hospital live? Is this home live? So we're still recommending that everybody send the paperwork so it's a consistent workflow, but hopefully eventually we can eliminate that. This is a phased implementation approach, so until we get everybody live, we want the workflows to be consistent. The other few data elements I'll show you, and then I'll talk about that bi-directional workflow. Advanced directives, if the resident had an advanced directive like no CPR, it would be listed here. We show you the last set of weights and vitals that were taken at the hospital. Lab results, it will show you the final lab results and all the pertinent information like the date it was taken, you know, the reference range, and it will point out if it was normal or abnormal for you. And so you can see that just opening them up. Radiology results, it will say the name of the test that was done. Right now, currently, we aren't bringing in the actual narrative into this particular section of the inbound tab, but we do have the results of the narrative in that document that opened up when I first went into the inbound tab. And then the last data element is the social history, which we're currently pulling in their tobacco history or smoking history. So what we've done here is we've pulled in the data for that resident from that hospital encounter. So it's a snapshot in time, right? It's whatever was available when the hospital discharged that resident. And now, let's say this Andre, his condition worsened, and I have to transfer him back to the emergency room. Then what I would do, I have two ways to kind of note that in Point Click Care, which we always, a typical workflow to note when a resident gets transferred out. So if it's the business office during the day, they usually use a census event here. But we also created this other tool called Quick ADT for the nurses to be able to transfer somebody out quickly. So what they do is they just click on that, they put in transfer out, and very simply, they complete a few other fields. They're going to the acute care hospital, and then they say which hospital they're going to. So this is really key here. When they say they're going to the hospital and which hospital they're going to, that's how we know where to send the data to. So if that hospital is live and this Cordalucci McKenzie is live, once they hit save, we would send it over to the Epic system at McKenzie Health, which is Cordalucci McKenzie. And then it would go into Epic for that resident. So again, it's real time that when we click on this, we push it over. And the same thing on the hospital side. If it's Epic Hospital, they're pushing it to us. If it's the Meditech or Cerner, when we admit a resident, we're actually doing a query behind the scenes. So it's bi-directional, and it includes all of the acute encounters. When somebody goes to the emergency room or inpatient environment, it currently does not include outpatient visits, et cetera. So it's just emergency rooms and inpatient environments. That's what we're starting. So any questions before I turn it back to the Project Amplify team, or anything you want me to go in more detail about?
I'm just curious, Cheryl, when you go into quick ADT, how does like the Winchester Hospital know that I'm sending that patient or that resident?
Oh, they would.
When they register the resident, does it pop up to say that I've transferred the file over, or do they?
I'm after that in the Project Amplify team. Remind me, is Winchester part of Atlas Alliance?
They are, Cheryl. I can speak to that. Sorry. So the process, the quick ADT is completed in the point of care system, and then upon arrival into either the ED or the direct admission department at the Epic Hospital side, the patient's registered, triaged, etc., and that act in the Epic system completes the query to point click care and pulls the data into the patient's chart in the Epic system via the Care Everywhere module. So in the patient header, depending upon the configuration at the site, there could be two different icons that shows that there's external information available from an outside source that can be reviewed and reconciled. And in the case that we're talking about here, the information would come from the long-term care home that's integrated with the Atlas Alliance Hospital.
Okay, thank you.
Looks like Shamida, you have another question for us.
Yeah, I was just looking at the, I just logged into my point click care, and I see now the inbound. I was always wondering what it was. So I now understand what it is, and was clicking to it, and it's wonderful that all the information is available. The area where you said a provincial import, where you said that you can download the OLS, my understanding was that at least in Osgood Care, our point click care cannot populate the lab results. So they're still paper based. I don't see that icon in the point click care. It says clinical viewer. So I'm not sure whether it's the same thing or it is something completely different.
Yeah, the clinical viewer it's the same thing. It's going out to provincial repository. So it depends on your subscription. That is something that you subscribe to get those lab results. So I can look into it after this for you. Did you say the home was Osgood?
Yeah, Osgood, yeah. And I'm not the medical director over there.
No,
I'm
but
just a physician working there. Yeah.
If they have it, that maybe you need a login for it, because those applications you do need a login for it. So I just will make sure that if they have it, that you can have access to it. But if you did have it, when you did pull it in, it's kind of a pull model. When you click on that, like that clinical viewer and the import, then it pulls into the inbound tab.
Shamida, do you have the clinical viewer in your office?
Nope.
Okay. Do you have a One ID?
I do, yes.
Okay, so then it just needs to be set up, and you can actually be set up for the clinical viewer in your office as well.
Okay.
Yeah.
Okay, thanks. And my last question, sorry about this. When the patient is ready to go to the hospital for any emergency, say somebody has aspiration and the O2 sats are low and we need to send them to the hospital, the ambulance comes in and we don't know which hospital they're going to go to. So I think that's where the problem comes in, that how does the nurses know where to send the report, because it's hospital based, like you have to know which hospital the patient is going into.
Yeah, I'm glad you brought that up, because it is a common scenario, unfortunately, but it is the nature of those transitions, right? So what we do advise our end users, our homes, to always put in a choice of to be determined in that drop down, because that will become, that's one of the configurations we have them do. We have them make that mandatory. So once you go live with Project Amplify, you will have to select something. This will have a red asterisk. You see, you have to select something. So we always tell them to put in to be determined. And in that case, unfortunately, we can't send the data because we don't know where it goes. So that's another good reason why you still have to send the paperwork.
Okay.
Yeah.
All right. Thank you.
Sure. Okay. Anything else? Otherwise, I'll turn it back. Thank you, guys. I appreciate all the questions.
You share. I'll just get my screen back up here. Okay. Before I move ahead with the next section of content, I did just want to note that kind of when we look at these lists of the long-term care home implementation scope, so this is kind of what's currently in scope. However, these do occasionally change. Hopefully they don't change too significantly, but just wanted to flag that piece as well. Okay, so the kind of next section of content is I'm going to kind of delve into that kind of change impact side. So kind of we've chatted about kind of what is Project Amplify, kind of why does this matter? Why are we doing this work? What does this look like in point-click care? But as we know, with kind of any change, any new initiative, whether a digital initiative or otherwise, there's always kind of a significant human element. And in order for kind of any new project or initiative to be successful, we need to ensure that the people responsible for kind of adopting that change know what the change is, why it matters, and as well as kind of what is expected to them. And so how and where does this impact their day-to-day work? So we conducted a change impact assessments for both hospitals and long-term care homes to get a better understanding of how through like which users, which workflows, and kind of how their day-to-day is impacted through the implementation of Project Amplify. So I'm only going to be showing the change impact assessment for long-term care homes at this meeting. So in long-term care homes, there's really three workflows and the associated end users that are impacted through the implementation of this work. So the first group are any staff who are responsible for admitting and discharging a patient kind of to and from the hospital. So as Cheryl just demonstrated, the kind of had that workflow using the quick ADT functionality. And then, so that's primarily your administrative staff and your nursing staff are responsible for completing those workflows. The next group are kind of any team members, and this would primarily be your clinicians, so your nurses, physicians, nurse practitioners, and then working collaboratively with your pharmacy teams as well. To complete that review of incoming external data, and then that reconciliation, so determining what should or should not be added to the local patient's chart. And then lastly, so any staff that have access to view the chart, and the benefit to that group is that they will have more clinical data available to them to view and reference. So this is kind of a bit repetitive from what Cheryl just presented on, but again, just trying to highlight again where Amplify interacts with point-click care, and again, which staff are kind of responsible for those workflows. So, and as mentioned, that admit, discharge, transfer activity, and kind of highlighting that this is really that integral step, selecting the name of the hospital when it's known to facilitate that push of resident health data to the hospital EHR when the patient is being discharged to the hospital, and then upon readmission to the long-term care home, or for new admissions, if a new admit is arriving to the long-term care home from a hospital, accurate completion of that ADT activity facilitates that pull of health data into that inbound tab, which Cheryl showed. And then again, within the inbound tab is where you'd find any of that external health data received from those outside facilities to which you are connected with. And then lastly, so this is specific to when you're exchanging with Epic hospitals. So when there is the hospital may send over information to your long-term care home, there may be some demographic mismatch. So they in the long-term care home, you use a nickname for the patient, and then at the long-term care at the hospital, they use their legal name or kind of however that may be reflected. So if there is a mismatch on that demographic information, it will land in the external pending tab, and then will then just need to be reviewed by staff to verify that resident match, which will then move that health data into the inbound tab. So also, it's important for us to know when we're thinking about where to target our change management and training efforts, and what are some of the challenges for long-term care homes with adopting a change. So the first one is really around that variability in user types. So who can discharge, admit, and update resident charts with the Project AMPLIFI data. So we need to be cognizant that there can be this variation between long-term care homes or even within long-term care homes. So, and as physicians, you may work at multiple long-term care homes. And so again, there may be kind of slightly different workflows that you need to learn and adapt to as part of Project AMPLIFI. The next one is a variability in PCC software upgrades. So this was Cheryl had alluded to this. So just depending on your subscriptions and kind of what subscriptions the long-term care home has. So if they have additional upgrades such as eConnect or eConnect Plus, then the staff are generally already more familiar with accessing external data from you through that inbound tab. So it's just that and when we're thinking about change management and training, again, what is that baseline knowledge and level of comfort with using the inbound tab to access external data. And then lastly, so in variation in those medication reconciliation workflows, kind of similar to the first challenge, again, who and how staff are going to be interacting with the Project AMPLIFI data can, again, vary within and between homes. So kind of with this knowledge of kind of what the impact is and what some of those challenges are, what are those key workflows we need to focus on. So we've Point Click Care and us in collaboration with Point Click Care developed lots of training content and opportunities for you to learn about the workflows and the functionality and the solutions. So I'll be circulating the slide deck afterwards. These are the training resources that have been developed by Point Click Care to help support end users with learning about the functionality. And you could, depending on your role, kind of focus in on kind of what is most pertinent and relevant to you and your day-to-day workflows. And these are all hyperlinked to the content. And are accessed kind of directly through Point Click Care. And then kind of aside from the self-directed training content, Point Click Care also offers live classes that you could self-register for to help you become more familiar with these workflows. So it's offered 3 times a month. And again, these are the links for you to be able to self-register for these courses. And then lastly, so our team has developed a change management toolkit. And so some of the key content in there really includes the implementation timelines and checklists, your change impact management plans, and then also the key messages and communication templates, just to, again, help familiarize team members and staff with what is Project AMPLIFI, what is the goal, and what is the purpose of all this work we are doing, and what is that impact on you and your day-to-day work. And it also, within the toolkit, it outlines what the training content is and includes the hyperlinks to all the content. Okay, any questions on any of the change impact and change management and training content available?
Yeah, I'm just trying to figure out who at a nursing home would have taken the lead on some of that. Particularly with physicians who tend to be sort of a breeze in, breeze out kind of phenomenon, particularly in the rural environment, which is primarily the Great River OHT. Cornwall is a small city, we'll call it. But the rest of us are quite rural. You know, I would typically have gone in for maybe an hour every 2 weeks. Not really time to sit down and do a full training module or, you know, go through 47 things that I need to click through in order to get educated. So I'm wondering who took on that training lead. Was that your team, or was that expected that the homes did that?
So it'd be kind of a combination. We've been trying lots of different angles of kind of how we can best engage physician groups. Kind of typically the point-click care team and ourselves at St. Joe's, we would engage most with like the director of care or the home administrator. And kind of we adopt that train the trainer model and have put share the content and resources with them with the expectation then that they'll then disseminate that out to the relevant staff members in the home, and so physicians included in that group. Kind of how often and how well that gets done. Again, acknowledging that it is a challenge to kind of even engage physicians who are in and out of the home, but even nurses and who are there and it could be their full-time employment, but again, busy with clinical tasks and kind of not finding an opportunity to fully engage with the content. So, and we've really adopted that train the trainer model. But again, we acknowledge that it's not perfect, but that's again the best route we've taken to kind of disseminate it out. And again, we've had opportunities such as this to engage with physician groups directly to provide that education and awareness.
Yeah, I think it's good feedback for your end of project report to the ministry or whoever your funder is, whether it's OH or the ministry or DHAC, to say, you know, really the train the trainer is fine, but dedicated training funding, if you want optimization of use, you can get, you know, basic use. And you know, I can drive the car knowing where the gas pedal and the steering wheel and the brakes are. But if I really want to use my car properly, I really do need to know how to use the windshield wipers and the rear windshield wiper and the blinker and, you know, all those other things. So I would strongly advocate. We saw this with the EPIC implementation in the Atlas Alliance, that the challenge with getting physicians and nurses well trained to actually use the tool in an effective and efficient way really impacted not only their day-to-day workflow, but also patient care for quite a long time. And, you know, with the constant changes every 2 weeks, which we talked about at the very beginning of this, you know, that just adds additional burden. We're trying to keep up with, you know, the latest in diabetes research and which medications we should prescribe. The last thing we want to do is know that there's a new button to click. So I think it's just important. It's not a fault for your team. I'm sure you were only funded to do what you did, but important, I think, for the system to recognize that adequately training the people who are using these tools to the point where they can use them effectively and efficiently really does improve the system, and that it's an investment that needs to happen.
Absolutely, I agree with you on that front, and I like that analogy with the learning how to drive a car. I'm going to use that one in the future. Thanks. Any other comments or questions on this topic? Okay. So I just have a few more slides here about the benefits realization work that our team is undertaking. So in compliance with the Ministry of Health and Ministry of Long-Term Care Project AMPLIFI agreement, care provider perspectives and transfer patient level data is to be collected from participating hospitals. So it's all three vendors, so Epic, Oracle Health, and Meditech, as well as the long-term care homes for the following benefits realization metrics. So from the patient transfer level, the metrics we'll be looking at are number of patients transferred between long-term care homes and hospitals, number of health records exchanged and digital views, number of exchange data elements reconciled or imported into the local patient record, hospital readmission rate from a long-term care home where the solution is live, and the number of long-term care home patient hospital days, hospital length of stay at live sites. And then from the care provider level, We'll be looking at the impact of staff and healthcare provider satisfaction and perspectives on the solution, as well as the estimated and measured time savings. So when we're looking at the impact on staff and healthcare provider satisfaction and perspective on the solution, so a provider experiencing survey is being distributed on the SurveyMonkey platform. And we're going to be looking at the percent of users that indicated the solution improves patient safety, percentage of users that indicated the solution reduced transcription errors, percentage of users that indicate the solution improves the quality of their decision making, a percentage of users that indicate the solution expedites patient care decisions more quickly, the percentage of users that indicated the training provided was sufficient, and lastly, the percentage of users that indicated very satisfied or satisfied with the data integration solution. So users will be further analyzed according to role, so a nurse, EDMD, long-term care MD, pharmacist, etc. So Hunter, to the Marilyn, to your point, to our conversation around training, it is one of the metrics that we are looking at around if that training was sufficient, and again, as a way to kind of learn of what we could do differently on subsequent projects. So as staff members of a Project AMPLIFI hospital long-term care site who has implemented the solution, you're invited to participate in the benefits realization survey to evaluate the effectiveness and utilization of the point-click data integration solution. So we've embedded this QR code. So again, as clinicians working in long-term care, we really appreciate you taking the approximately 10 minutes to complete the survey to support with our benefits realization work. So that is all I have on in terms of content for today. So if there are any other questions about anything that we touched upon or didn't touch upon in the slide deck.
Maybe you can just take the share screen down, and if there are questions, we can answer them. And I mean, I think it looks really functional. I think it definitely will reduce transcription errors, or at least I would hope it would. And I think it's a really exciting project. And thank you for leading the work for the province, Shamita.
Hi, thank you. Yeah, I echo you in terms of the training part. When I came on board at the Osgood Care Center and when Point Click Care was there, I learned by myself, so there was no training. And I just heard about the inbound button, so I just clicked it and I found all the information that was provided. The question is that could it be possible that even though we are active, but we haven't been trained or not informed of this bilateral integration between the hospital and the care center?
Yes, we can always offer additional training. We have several options for you. You know, if you have a time, maybe when a group of the physicians get together for a meeting, I can join that meeting and do a training like I did now, but more in depth in the demo. We also have set instructor-led training sessions throughout the month that you could register for. I can send you the links for that. And then I don't know if you're familiar with our e-courses called Relias or Smart Zone. We have those courses too. They're about 15 minutes. Clinical data exchange. So I don't.
And are those
whenever I don't know anything, I go there and find out.
Yes, you're exactly right. You could just type in, clinical data exchange inbound tab, and it should bring you to it. The word Project AMPLIFI won't bring it up, but if you use any of those words, it will.
Okay.
Yeah, it'll bring you to the right course. But I could, after this, send you the course number to save you some time, send you the links for those courses. And if you decide that you want, me to do any further training on some kind of physician meeting or anything one-on-one, just let me know.
Okay, thank you.
Thanks, Cheryl. That's terrific.
Sure.
Any other questions for the team? I had 14 people also signed up for this in addition to the people that joined. But things happen, but I will certainly share the recording, and Cheryl, you may be getting a few taps or
That's
at least
okay.
a few clicks on your website for finding some training. So I think this has been really useful.
Yeah, and I
Excited
appreciate, the feedback, because we typically, work with the administrator and director of cares to get all the people in our kickoff calls and training. So it's just, we might need to be more proactive about asking, how can we engage the physicians?
Yeah, well, OHTs may be a good option, or clusters might be a good option to say, if you're working in a cluster of long-term care homes, is there a way for us to have the physicians and NPs from 6 or 7 different homes attend one session? Might be more useful.
Yeah,
there
I
are
was
ways to
kind
do that.
surprised that Shamida actually had the access to the inbound tabs. I'm thinking, well, somebody gave it to her. You'd think they would have,
Yeah, I just,
for the drink. Somebody consciously gave you that permission.
oh, I'm glad, because otherwise I would never be able to know what you were talking about. Yeah.
Yeah.
And I think the other option would be to have this evening kind of training session online, because a lot of physicians hesitance would be because we are also running the clinic at the same time while visiting the long-term care. And if there is something like this available, like this is making me more exciting to use and go in and find out more information about the point-click care and how to use it more effectively. So I think more training and more effective use of the EMR is always good. And we know in our clinics also, when we use the EMR, it's always effective if there is a super user and you can tell one click button and it can change your life.
I know.
Tyler.
I just want to say on behalf of the AMPLIFI team, I want to thank Monroe for pulling us together. He kind of started this conversation, I guess it was before Christmas, but again, greatly appreciate the opportunity for engagement, Monroe, and working with your teams, especially at Cornwall Community Hospital. So this has been highly beneficial, I think, for a number of reasons. But again, thank you for introducing and making the connection.
Yeah. And Tyler, it's one of the nice things about working in a more rural area. I am also the digital health lead for the Great River OHT. So I get to make those connections when Marilyn comes to me, and I know the project team because of my other work. We got lots of hats in a small rural area, and our fingers are in lots of pies. So it was great to put it all together.
Yes, you wear lots of hats, apparently.
Sometimes.
Much appreciated, everyone. I'm going to let you go, and I will be forwarding the recording to the people who registered for the webinar and were unable to attend. But I'm sure people will reach out through their long-term care home if they have further questions to either Cheryl and the PCC group or Tyler and the AMPLIFI group.
Yeah, and I'll send you, Marilyn, the name of that course and the links to register for training so that you can send that out on the same time.
I'll put it in the email. That's terrific.
Yeah,
Thank you so much.
Tonight. Send it over to you. Okay.
Perfect.
Sounds good.
And I'll be sending the PDF of the slide deck as well, so you can circulate that as well. And I have in there, I also have the links to all the training that Cheryl's referencing, but having it outside of the slide deck as well, I can appreciate it's helpful to.
She's got some great quick links that will take you to it. Yeah.
Yeah.
That's
super.
Yeah. Okay.
Awesome. Well, thank you everybody for your time and spending your evening with us. And we'll pull together another group if there's a big update at a future date. Good luck with the rest of your project.
Thank you.
Thanks.
Take care, everyone.
Take care.
Bye-bye.